What if oxygen could become medicine? What if your blood could be treated outside your body and come back more efficient, calmer, and more resilient? And what if much of what you've heard about ozone therapy is only part of the story? Today I want to walk you through a scientific article that quietly explains why extracorporeal ozone therapy works. Not opinions, not marketing, biology. This article is titled Extracorporeal Blood Oxygenation and Ozonation, Clinical and Biological Implications of Ozone Therapy. It was written by Dr. Bacci and colleagues, researchers who have published extensively on ozone biology. This paper is foundational. If you follow this channel, you know I talk a lot about ozone therapy, EBOO, MAH, multipass ozone, bio-oxidative medicine. But today we're not talking protocols, we're talking mechanisms, because if you don't understand what ozone actually does, you'll never use it well. Here's the first myth we need to clear up. Ozone therapy is not about flooding the body with ozone. Ozone never circulates as ozone in the bloodstream. It reacts instantly. What matters is what comes after that reaction. This paper makes a critical point. Ozone acts as a biological modulator, not as a disinfectant. This single idea explains why ozone can improve oxygen delivery, modulate immune function, reduce chronic inflammation, and support mitochondrial activity. This is signaling biology. Let's walk through it step by step. Step 1. Plasma reactions. When blood is exposed to a precise oxygen-ozone mixture outside the body, ozone reacts with plasma lipids and antioxidants. This creates secondary messengers, not damage, signals. These signals are short-lived but powerful. Step 2. Red blood cell function. One of the most important sections of this paper focuses on red blood cells. After ozonation, red blood cells become more flexible, they release oxygen more efficiently, microcirculation improves. This matters in conditions like chronic fatigue, long COVID, neuroinflammation, vascular disease, and mitochondrial dysfunction. You're not forcing oxygen in, you're restoring the blood's ability to deliver it. Step 3. Immune modulation. Here's where ozone gets misunderstood again. Ozone does not stimulate the immune system, it modulates it. That means overactive immune systems calm down, underperforming immune systems wake up. This helps explain why ozone has been studied in chronic infections, autoimmune conditions, cancer support, and post-viral syndromes. It nudges the immune system towards balance. This paper draws an important distinction. There is oxidative damage and then there's oxidative signaling. Low-dose controlled oxidative signals activate antioxidant pathways, improve redox balance, and increase cellular resilience. This is hormesis. A small intelligent stress creates a stronger system. Now let me explain why extracorporeal methods matter. The authors emphasize that treating blood outside the body changes everything. Why? Because dosing is precise, exposure is uniform, the lungs are bypassed, and systemic effects are predictable. This is the biological logic behind EBOO, modern MAH protocols, and multipass ozone strategies. This paper explains why those methods work. From a clinical standpoint, this helps explain why ozone therapy may support patients with chronic inflammation, poor oxygen utilization, immune dysregulation, neurodegenerative processes, and cancer-related fatigue. It also explains why dose and timing matter. Ozone is not generic, it is contextual. This article isn't new, but it is foundational. It helps shape modern bio-oxidative medicine, and many clinicians still use ozone without understanding this biology. When you understand the mechanisms, you dose differently, you combine therapies differently, and you choose patients more carefully. That's how outcomes improve. So I'll leave you with a few questions. What if chronic illness is less about deficiency and more about failed signaling? What if oxygen delivery and oxygen utilization and not oxygen supply is the real bottleneck? What if controlled oxidative stress is not the enemy, but the teacher? And what if extracorporeal ozone therapy is less about killing disease and more about restoring intelligence to biology? If this helped you think differently, share it with someone who's curious but skeptical. And if you'd like a follow-up on EBOO versus MAH versus 10-pass ozone from a clinical decision-making perspective, let me know in the comments, because the future of medicine isn't louder, it's more precise.